let's talk about the difference between prioritization and time management. So, before I talked about distractions and that oftentimes in nursing we get distracted and that can lead to errors. But it can also lead to issues with prioritization, which can sometimes look like a time management issue, but it's actually a decision making issue. So, when we're students, we often learn about checklists, and I talked about my own checklist, which I do still use to remind me to do the things that have to get done by the end of the shift. Give the med, complete the assessment, document the care, provide patient teaching. Those items still need to happen, but throughout the shift, other issues are going to arise, right? So those are all important things that need to get done before the end of your shift, but it's not going to always happen in the order that you intended to happen at the beginning of your shift. So we talked about distractions. So you're sitting down to chart and you have a scheduled medication due in 30 minutes, but then a family wants an update and now your patient's O2 sat is dropping and then a call bell's ringing and somebody else needs help. And so it's easy when you're new to an area or new to nursing where this all feels urgent and overwhelming because it seems like everything has to get done right now. But it doesn't. That's the lesson, right? Everything does matter. Everything matters. You have to get everything done by the end of your shift, but not everything matters right now. So this is where you have to learn to prioritize in a non-static environment, right? So how do you prioritize when everything isn't in a neat checklist from a textbook? How do you think about this? And sometimes we think about this like time management, but it's actually, like I said, more decision management. So time management is how do I manage my time when I know all the things I have to manage. But prioritization and decision management is how do I manage my time while also managing my priorities and making decisions. So you're constantly asking yourself, what are the safety things that I need to address first? So we use things like ABC, right? So airway, breathing, circulation. If there's something affecting airway, breathing, circulation with your patient, 100%, that's always going to be the priority, right? So that O2 sat that's dropping, that could be a real dropping O2 sat. You've got to go and check that, right? You want to go into the room, you want to check your patient, you want to make sure that the equipment is functioning, you want to recheck on a different finger perhaps, because that needs to be addressed right now. If their oxygen is actually decreasing, you need to intervene now. So that automatically moves to the top of the list no matter what else you were doing. The medication may be important, but remember that you have a little bit of a buffer between the time it's due, 9 a.m., and giving it slightly before or slightly after. So although medications are extremely important and must be given in a timely manner, it doesn't have to be given at 9 o'clock. The family absolutely deserves an update, but you can swing by and say, listen, I really want to chat with you guys. I'm just dealing with a couple other issues and I'll be back. And of course, call bells need to be answered, but we have to address the immediate safety concerns first. Then we can reassess. So priorities change throughout the shift. Priorities change with every assessment. You might walk into a room anticipating that patient X is going to be your patient who's going to go home today and they're likely for discharge. And when you go in and do your assessment, suddenly they're not going home today and you need to do a lot of interventions and they're actually much sicker. So what something that was your priority 5 minutes ago may not be your priority now. So the more experience you get, the more you'll learn how to manage these priorities on the fly. And so sometimes you look at really experienced nurses and you say, oh, they do things so quickly or they have really good time management. But it's not necessarily that. It's that they can identify what needs their attention first, second, and third, and then know where to fit everything in between because they've developed that skill. It's a skill that develops like many others with experience. So if you're a new nurse on a new unit, because this will happen if you move into a new position, onto a new unit, and of course, if you're a student just starting out and struggling to prioritize, it's okay. It means that you are in the midst of learning for the unit that you're on, where the priorities lie, how the priorities can change. And so the goal is never not to do everything at once. You can't do everything at once. The goal is to choose the thing that you must do first and then go from there. So you'll have your checklist, you'll have your things, and you'll say, okay, where do I go first, and then rearrange my priorities from there. Your checklist is still going to help you to make sure that you have everything done at the end of the shift, but your priorities are going to shift. So how that's going to look. It's not that you don't know enough. It's that you are learning how to process all these competing demands at the same time. So you've got all these distractions that are distracting you and could cause error, but some of these distractions also are going to change your priority list. So this takes a lot of practice. One day you're going to walk into these situations and think this is overwhelming, and then all of a sudden you're like, oh, I know what to do first. That's practice. It's experience. It's something that we can't fully teach you at school. We can't fully teach you at orientation. You just have to trust in the process that right now, if you don't know what to do first, ask somebody, call for help, make sure that you work through those things. What do I want to do first? Why do I want to do it first? Because you don't have to do everything at once. You just need to identify the safest thing to do next. Hope that helps.